Good afternoon and good morning to everyone. Today is the 1824th day of uninterrupted daily webinar of International Forum for Promoting Homeopathy. And now it's time for our international session. And today's our guest is Dr. SADAT SAIT, who is Chief Physician at Dr. SAIT's Homeopathy at Cochin and Aluva in Kerala. He is a leader at various homeopathic organizations and has taken webinar in all three languages at IFPH. And Sir has more than 27 years of experience. And today's topic is on respiratory disorders and its homeopathic management, part 2. So let's welcome Dr. Sadat Seth, sir. And over to you, sir.
So the doctor has not joined. Let me call. You may talk about our celebration for the time. Yes. On September 28th of this month, this year, we are celebrating the 5th anniversary of International Forum for Promoting Homeopathy. And we have arranged a lot of sessions in that day because it being a one-day session, we will have to avoid many big sessions. Instead, we are presenting short sessions. There will be interactive session for students, and there will be sessions for agro-homeopathy, veterinary homeopathy, dental homeopathy, and there will be some other presentations also, and there is a presentation on cancer by Dr. Krishnan, and at the end there will be some cultural program from our part, and these are the things we arranged for you. Doctor, you can say something about respiratory disorders. In between, I shall call Dr. Sadat. I'm inviting Dr. Beatrice to say a few words on your experience in respiratory disorder. Right?
Thank you, Dr. Danish. And thank you. I'm greeting my dear friends from IFPH, and all of you are looking forward to have the 5th anniversary of the founding of IFPH. I feel that will be a very great event, the 5th anniversary. And okay, Dr. Danish, what would you like me to talk about?
You can say a few words from your experience on respiratory disorders with homeopathy, if you have some cases, because we know that being a homeopath, people used to come to us with all kind of diseases. Sometimes we know that most of the skin diseases, when suppressed, it may go into asthma. And in those conditions, some of the medicines, our homeopathic medicines work in a better way. Unfortunately, doctors from other side or don't think in that way. So they whenever their skin condition comes, they used to suppress with some steroids or something like that, and that may later come up as asthma or some other gastric disorders.
Yes. So what we also can see in our clinics, that sometimes skin eruptions are shifting to the respiratory tract, and that as allopathic doctors, they say that's normal. That is normal. That it belongs to the group of atopic diseases. But we as homeopathic doctors, we know that is not the right direction. So to be practical, Dr. Danish, I had today a phone call of a family. It's a nice little girl who's going very well since more or less half a year on sulfur. Oh, hello. Hello. And she's a nice singer, your granddaughter. She's a nice singer, and that. So no, today I received a phone call. That's from the practical point of our work, and a very nice little child, and she was with eczema, And more or less since half a year now, he's doing well on sulfur. On sulfur and impotencies, if there's a reaction, she takes some drops and is recovering. So, but now the mother is telling that she's developing more respiratory problems. So, and she said, I was with a pediatrician, and he said that's normal, that's not a problem. But I said, no, we have to come again, and we will have to change the remedy. So that's from the practical point of view, and I am here to listen to your colleague who would like, who's going to talk about the respiratory problems. So I hope he will come soon.
Yes, yes. Unfortunately, he was in a traffic jam, and that's the reason why.
I see. I
Because
see.
this
I
is
could talk then also about another point. Yesterday, Dr. Danish, I was connected with Argentina, and the group of the colleagues of Argentina, Dr. Gianpietro, you know him very well. He also was presenting a very interesting case about a respiratory problem. It was a girl of 8 years, and she sometimes had such great difficulties. She had to go to the hospital, and she had to got an intubation. I mean, that's really, really severe. So he described the child. It was a little girl, 8 years old. She was extremely selfish. She did not care about the others. Her younger sisters and brothers, she would take the toys, and she would not like to give anything to anybody. And she was very, very much self-centered. And she did like sweeps and other modalities. So she received a sulfur with a very good effect. As you know, in Argentina, they use LM potencies in a special way, also high potencies. I don't understand everything about that, but it was impressive that this child was ameliorating. And Dr. Danish, there was a point, I never heard this. There was a point, then the child got more effective, more sweet, was caring more. She did not want to be alone, and she wanted to have other people around her. So totally different. So after more or less 1 year of sulfur, she changed to phosphorus. I've never seen that. It's such a big change. But with phosphorus, she was very good, and it was a case of more than 20 years. She's now 28 years, has children, is doing very well. And Dr. Gianpiero is giving phosphorus LM potency every 6 months, just to maintain a certain dosage. So yes, did you ever see a sulfur personality changing into a phosphorus?
Yes, that's what actually the child may be phosphorus from the beginning, but unfortunately, due to certain circumstances, child character went back to sulfur. That may be went to sulfur, and that may be the reason why such a suppression, some kind of suppression happened somewhere in the life of that child, and that may be the reason why she becomes sulfur at the time of consultation. And yeah, actually, as you know that in acute diseases or even a chronic disease, when we give sulfur as the first remedy, naturally the real person inside the patient will come out, and then you can go with the right choice of the remedy. That also is a very good. This is what most of the doctors in Kerala used to do when they get an acute or a chronic disease. We were not about. The exact some people may not explain what is the real cause behind the illness, or what are the things that she has happened or he has suffered during their lifetime. So after taking sulfur, sometimes the real picture of the patient may come to when the very next visit itself, the patient may reveal that.
Yes, yes, I understand. And perhaps
Doctor.
there had been a lot of suppression by allopathic remedies for the respiratory problem, and she changed. But it was a nice development.
Yes, exactly,
So
exactly, exactly. The mind, the homeopathy, that's the reason why we used to say the homeopathic medicines are the best counselors, because that medicine will bring back the person to normal level, and the mind of the patient will be changed in such a way that the person will be a very good citizen, or a person for the country as well as to the community. That,
Yes, yes.
because that kind of changes can be produced with our homeopathic medicine. I have seen several times that I still remember a case of a boy who was just having asthma. When they visited me with asthma, what happened was I asked them what was the reason behind this problem, and they told me that, doctor, we couldn't come over here. They were residing just half a kilometers away from my clinic, but still they didn't came to me up to 5 years. And then I asked, why you are not coming still? Why you didn't come over here earlier? Then they told me that, oh, doctor, this child was suffering from the second month of delivery itself, and so that's the reason why we just went up to this several hospital and admitted. We need to admit him for hospital for this respiratory complaints. Several time he suffered from pneumonia, and as a result, he was taking lot of medicines from the very second month onwards. That may be that. Then we thought how the homeopathic medicine will work on such a child. This was the question they shouted to me. Then I told them, don't worry. It doesn't matter whether it is whether you are taking homeopathy or allopathic medicine. Doesn't matter much. What we do is that we take the case in detail and then we go. Then after I asked them, what is your financial position and everything. They told the bystander told me that, doctor, this child and along with her mother was supposed to suicide in a railway track, and some people caught them from there. They watched them. They are lying on the railway track, and the mother took. Some people watched seen this, and they brought this child to this home, and somebody around her house asked them to take homeopathy, and that's how they visited me. And after taking, then he was a very, very mischievous child and very doing everything. He was taking my stethoscope, he's running away, he's taking my apparatus, he was like breaking all the newspapers and magazines in the visiting room. So from the very visit itself, after watching the child, I just gave him a dose of tuberculum first, and before taking the case itself. And after taking the case, then I found that I can, because the parents used to quarrel every now and then. There was a quarrel going on between the grandmother and with the mother of the child, and as a result, they were even during the pregnancy of the child itself, there was a big quarrel going on. So as a result, these are the things that I told them, that these are the things that made your child such a pathetic condition. So we can treat it. And after some 1 year, the child was a totally different person. He never went back to any hospital, and he was totally cured. And he not only cured, then I can see one day while I was consulting, I can see through the half door that he was sitting outside and reading the magazine without disturbing anyone. That kind of
Interesting.
mental activity can be changed with homeopathic medicine. That is the power of homeopathic medicine. Can you believe it? But after that, he was a typical person later on. That is one fine early morning. This boy was brought to my home by about some 5:30 or so. I was not there. I was just in the railway station with my daughter. And then all of a sudden, my assistant was there in my home. He called me and I told, then this boy was crying like anything. And then I told him, don't worry, this uncle will give you the medicine from the clinic and you may go there and you may take it. And all of a sudden, everything went up. I told him that if at all any problem, you can call me by evening or you can come back because I was traveling to Canada, so I couldn't come back in the night. So I will be reaching in the morning only. And as a result, what happened was he didn't come back the very next day. But after 5 days, he came. He was everything okay. There is nothing like that. That's the nature of our certainly, when we give such a kind of counseling, that oh, you will be okay within no problem like that. That itself will remove the illness. That's what happens with the pulsatilla. That's the reason why a tuberculum patient or a carcinosum patient can be changed into the real person inside. That's how the person become pulsatilla, and thereafter he never developed this kind of pneumonias or asthma or anything like that. So that kind of changes can be produced with the homeopathic medicine.
Yes, that's impressive. Yes.
Yes, this is what we required here also. Some of the people never think that homeopathic doctors can do this and that. They believe that it's a simple medicine. And actually, most of the homeopaths in Kerala used to take 30th potency, or not be, most only very few people use LM potencies here. Most of the but it is working in a better way. But it works also. It doesn't mean that the potency, it doesn't matter whether you use LM potency or 30 potency or 3x potency or 1M potency. What matters is that your selection must be right one. That's what.
Yes, yes, I agree. Yes, I agree. But in certain cases, the C30, C200 is very good. In certain cases, LM are also very good, especially if we combine with allopathic medicine. Then we can give it every day, and we don't have harm the patient, and we can continue with allopathic medication if necessary.
Yeah.
We also have these patients here. Yes.
Yes, that also is the right thing, but still people believe that this can be, this will be, this for 30 potency or 200 potency give me the result. Then also I am getting result. Then why should I change? This is the question.
Yeah, of course, of course. If you have good results like this.
Just like same.
But like Dr. Danish, for
Yes,
have a patient and
Joe.
he has a chronic disease, autoimmune disease, he has to take cortisone and autoimmune suppressives. If you would start with a C30, how would you manage? Would you give the remedy every day or once a week, or how would you manage?
But actually, what we do is that whenever an acute disease come to your clinic, naturally you can give medicine. In the early part of my career, I used to give medicine in water doses, simply giving.
Mm-hmm.
People used to come up with a 100 ml bottle, and we took some sterilized water inside, and then pour one drop of the potency, right potency, and then ask them to take it every half an hour or 1 hour. So since when you get to the relief, you can stop it, and then we will give some two bottles of sac-like pills, these pills or biochemic medicine to make sure that they are taking medicine.
Yes,
Because
yes.
we are all private practices, and we have to set up we have to feed our family, as well as we have to live in a decent life also. So we need money also. So that's the reason
Yes.
why. But in the meantime, we can treat the patient and can prove that homeopathy is a better system than it. People can understand this from the very outlook also.
Yes, that's true.
Our
That's
our
true.
Jose Isaac sir is here. Sir, you can share some of your experiences, the respiratory disorders here, because Dr. Sadat will be joining shortly. That's the reason why.
Respiratory disorders.
Yes, sir. Dr. SADAT is to take the session, but unfortunately, he's in a traffic jam. He will be reaching soon.
No, respiratory diseases actually constitutes about 40% of the cases that the homeopaths. And in our country, mostly asthma, allergic rhinitis, these are the main ones where what I have observed is mostly these mineral remedies are the curative ones. Vegetable drugs does not help us much. And the repetition in acute and chronic disease is different. And many people take inhaler morning
Yes.
or 3 times a day, like that they come to us. And we usually tell them to reduce slowly, taper it and stop it, because it takes some time for the homeopathic medicine to take over or to give a sufficient reaction. So until that time, what I used to tell them is reduce, reduce, and reduce slowly. Within a period of 1 or 2 months, maybe they will be able to stop it. Then we go to the higher and higher potencies, then to the myasm, then to the constitution.
Yes, Dr. Jost, one question. If you start and the patient is coming and has an inhalation, let's say 3 times a day, and you
Ah.
start with your homeopathic remedy, how would you manage? Would you give C30 every day, or how
No,
would you
what I
manage?
used to say is I don't give every day, but I used to
Mm-hmm.
give it once in 4 days or something, unless it is very acute. Very
Yes.
acute conditions, we usually even we give it once in 2 hours or 3 hours even.
Yes, yes, of
Yeah.
course, of course. Uh-huh.
But it is easiest way of managing is because they are used to this inhaler for a long time. So
Mm-hmm.
you cannot withdraw it all of a sudden. So better
That's
thing is,
true.
and now I have my private practice. I'm not in the college now, but when I was in the college, we usually give this one pill in half a glass of water to be taken 1 spoon every 3 hours, 4 hours, or 5 hours, like that, until it comes down. But when we are treating it in the outpatient department, usually the patient is going home, and we may not be able to change the remedy or anything after observation. We observe the patient only after 2 or 3 days sometimes. So there what we do is we give a medicine, tell them to uh, take the inhaler only if necessary. Like that, it may go on for 1 or 2 months in very chronic cases. And after that, they can survive only with the homeopathic medicine. And then one of the most important and most efficacious remedy that we have seen is arsenic alb here.
Yes.
And in the Kent's Meteoromedic, it is said that arsenic alb cannot cure asthma, because Kent's main drug for asthma was natrosol. Maybe because of the climate and the damn coldness of in Europe and other countries. But in India, in our state, it's a warm place, so we have more arsenic. But arsenic iodide is the curative remedy, more curative, and if it is arsenic iodide, it will cure the case without the aid of any other complementary or supplementary remedies, miasmatic remedies or anything. It cures. But in case of arsenic alb, it takes you have to go to the Tuja, as he said in our Ken's lectures on Materia Medica under Tuja. He says that this statement comes in that chapter on Tuja. What he says is arsenic alb cannot cure. You have to follow it up with the Tuja. Another
That's
important
interesting.
remedy. The main problem, I think, is the treatment of respiratory diseases. The main thing is the case taking. In which posture the patient has got aggravation or amelioration. Then the next is time modality. Then the weather modality. These 3-4 things are very important because all the respiratory systems diseases depend on the air. So weather is very, very important. And once you know that these are the important things to be looked into in each case, easily we can arrive at the remedy. Because time modality is very important. Then one more thing is this moon phases. Our full moon remedies like Calcareum, Silesia, Alumina. So these are I think the problem is many people don't know what are the things to be looked into in a respiratory case. We have the general case taking, then after that the special one also should be there. The special one is to come to certain remedies. If we take that case properly, easily we can arrive at the remedy. But anyway, allergic conditions, homeopathy, I think, is in the leading level when compared to other systems of medicine. And it is increasing day by day, mainly because of many reasons, including the allopathic drugs and everything. What about you? Which is your main remedy in asthma?
Well, we just talked. Well, I could not say the main remedy. I don't see so much arsenicum here in Germany. I see more like Calcarea carbonica, also Lycopodium. In acute cases, if it's starting, there's infection of the nose, it's starting. Also, heparin sulfurous is a good remedy to not get into the state. And well, of course, the miasmatic treatment with tuberculinum or bacillinum is very helpful. Here we see that, very helpful.
Mostly chili remedies in your country.
Pardon, what did you ask?
No, mostly the chili remedies, I think.
Yeah, you're
Isn't
right.
it?
Mostly of course, could also be medurinum, could be, or sulfur. Mostly the chili remedies, that's true. And the asthma is mostly in the season. We have cold season, wet season. It's minus degrees, 5 degrees, a bit like in Russia. You know Russia a bit. It's more or less like this.
Yeah.
But
the blooming season. They call
astonished,
it the
Dr.
blooming
Jose. I'm
season.
astonished you have so much allergies in your countries in India. I was thinking it's more a problem of our cold countries.
No, not really. That because here mostly dust, then the weather changes. Then of course the genetic factor. If the father, mother, or somebody in the family has got asthma, usually the children get it. And another important factor is the suppression of skin disease in childhood. Because even when the child is born in a hospital, if there is a rash, immediately they apply some ointment. And even without the knowledge of the mother, they apply the ointment. So if you ask about the history of any skin disease, even the mother or father does not know. But many cases we see this because at first it may be a skin complaint. After some years, it changes to a nose block, sneezing, finally to asthma.
Yes, and the problem is then the allopathic doctors say this is normal. It can happen. And we as homeopathic doctors, we say, no, that's not normal. And but here in Germany, many families say no, if the children are having eczema, they don't like too much suppression and cortisone. So we have this. But with the respiratory tract, like Dr. Jose, if there's a little child, a few months, developing pneumonia, has to go to the hospital, coming back, perhaps another time. Here we would think mostly about tuberculinum or carcinosinum to give a nosode, to see what's happening in the
comes
family.
later, not in the acute phase.
Yeah, well, in the acute phase, they would be in the hospital here in Germany.
But in
coming,
here we get
to our clinic, we would give a carcinosinum to prevent to have it another time.
No, one difference which I have seen in between Europe and India is, in India,
Yes.
people come to the homeopathic hospitals during this acute
Yes.
phase also.
Yes.
But in your country, usually they don't come. They come after, the acute phase is over, they come to homeopathy.
Yeah, that's normally because
Oh,
we don't have homeopathic hospitals. They go to the
yeah,
hospital
yeah.
and then they come to us, and it's also working. And I really can say, Dr. Jose, I was working 40 years ago. I was working as an allopathic doctor in the hospital, and that was not easy if the people came with strong asthma, with a status asthmaticus. So as we had to give injections, and it was difficult. So they developed the sprays 40 years ago, more or less. And this was in a certain way helping that people did not go into such a severe state. And as allopathic doctors working at nights, we don't see these problems anymore because of the sprays.
Okay,
But
sir.
of course now the people come and they want to reduce the spray, and that's a good
Okay.
time to
Our
go.
our guest is
Okay,
our guest has joined now, and
okay.
Dr. Sadat said is here to this due to some. Yes, Doctor, you are the co-host. You can begin the second part of the same. Already the introduction is all over.
I'm getting into the straight ones.
Okay.
Okay, we left it. Can you hear me? Can you see this?
Yes, everything fine. You can
Okay,
go ahead.
sorry. First of all, let me say sorry. I will explain all that because my brother-in-law was not well. He is in ICU. So I was in that mood. Sorry. Okay. We just left it in the asthma and respiratory problems yesterday, 2 days back. Okay. When the asthma comes, my clinic and I, we give all the case taking everything medicines, but these are the medicines which we can even think about in asthma because it gives you beautiful results. Sterculia, it is also used. Sterculia is as if there is no air in that, and you cannot even take it out because the whole system is weak. That is the this one, and sterculia can also be given for bodybuilding, develop energy. Any bodybuilding or gymnastics or any that the people go to the gym can be used instead of that what are called steroids. Okay, Solanium lycopus, right deltoid pain. The back you get the deltoid pains also can be thought about the solanum. Solanum is a what are called that capsicum group. Okay, asthma with gastric derangements. You can think about it. When the asthma comes, the patient comes and tells you that your whole body or the abdomen is very bloated. Think about Sambucus, lobelia. Lobelia is a beautiful medicine with all the crypts are there. Okay, asthma aggravation sleep. It can be given for sleep apnea also. Merck precipitous rubras. Aggravation asthma, not the cough. Asthma aggravation by sleep. Okay, sleep apnea also can be thought about this medicines. Merck precipitous rubor. It's one of the beautiful medicines. You can even think about it in the this one, sleep apnea. Even if you don't have any asthma also. Inability to lie down. Again, sleep apnea, you can think about it. Convallaria majalis, that is heart remedy also. So you can think about all this. You have to rule out this congestive cardiac failure, dyspnea on walking as it stopped. That means when you start walking, we feel as if it stopped. Okay, so we miss the skip or we skip the beat. Okay, even you can think about it in CCF, congestive cardiac failure, as a almost like a specific. You can think about Cretiagus, you can think about cactus, but Cretiagus is one of the best medicine for this. Along with that, you can think about Convallaria majalis, the potency usually tincture to 30. Okay. Pericontritis. In respiratory, again, you get the pericontritis. The pain comes with the cardiac covering, the pericontrium gets inflamed. You get the rattling and crips, you have to differentiate with the breathing and this one. Diagnostic features you can think, you can read it up, but these are the medicines you can think about in that emergency condition to relieve that pericontritis. So these are the emergency situations where we can handle the medicine, handle the conditions. How many cases I have seen us? Maybe around 3-4 cases I have seen it in this, and usually it doesn't come to us, but still we get this kind of a cases. Congestive cardiac failure is a common condition. Now we can get it. We get it in the clinics. Okay, ruta and sinusificus, inframammary pain, and ruta is another one is Asclepias tuberosa. These three medicines you can beautifully. Bryonia is also there. Okay. But these three medicines, without these three medicines, you cannot even think about the treating pericarditis. Okay. Cough. Again, lactuca virosa. That is all. The lactuca virosa is a medicine which is used to increase the what is that milk in the breast. Feeding mothers doesn't get the milk, so that is almost specific and blindly when given lactuca virosa, you get a good results with that. Increase the breast milk. Along with that, you can think about lactuca virosa in cough. Senega, I think I have explained it. Osmodium, Oleum jack. Oleum jack cough is in the night, aggravation night. Oleum jack cough is in the only specific for aggravation night. Viburnum prunifolium, another one. Then Oleum centale is another one, aggravation night. Okay, Oleum centale even specifically told how to give it in boric also. Follow that. You can give it in what I call we say that sugar bricks. That we say calcundum, but sugar bricks. Put 2-3 drops of Oleum centale and give it. It's one of the beautiful medicine for that. Cough with asthma during talking, Drosera. If you're talking and you're getting difficulty in talking, difficulty in smallest exertion, again, Drosera. High potency and mother tincture also can be thought about it. Drosera, people say that every physician makes the juniors or anyone scared that Drosera cannot be repeated frequently. But my experience is Drosera is one of the best medicine I frequently repeated, even for the cough, even for the asthma, even for any conditions. Drosera is something which I frequently repeat if I get the symptoms of Drosera aggravation lying down. Even this after COVID, talking or slightest exertion aggravates the complaint. Okay. Cough during talk. Laryngitis, again, respiratory complaint, laryngitis, again, Senega, Manganum aceticum, selenium is due to the weakness of it. Kaolin is another almost, kaolin is a medicine which you can give it in a boric. You read that it almost gives all the symptoms of it. Laryngitis, again, hepatica. Hepatica is one medicine you cannot skip for the laryngitis. Okay, you have a laryngitis, we can give baptisia, we can give argental nitricum, we can give hepasulf, all that is there. Vyathia is another one of the medicine for laryngitis and pharyngitis, but it's a common medicine we think always, and we stuck to that. But we have all these medicines also even for this. Okay, Manganum aceticum, hepatica. Just it is not mentioned here, but kaolin and hepatica, it is a common prescription for me now. Okay, cough at night, again, Prunus virginianus. Prunus virginianus is another medicine we can think about it in abortions. Spottings, Prunus virginianus can be given or thought about in Viburnum prunifolium is another one which can be thought about it in abortion, spottings, starting of the abortion before the gush starts. Try this medicine, you can even stop the abortions, most of the cases. Then codanium is an alkaloid of opium. Opium is also one of the best medicine, but if you can get a codanium medicines, codanium 30, 200, 3x, whatever the medicine for you get it, whatever the potency you get it, codanium is also another one of the best medicines. Okay. Trifolium. Trifolium. How to give it is a clear cut. You get only 1 or 2 lines in the book. But 1 or 2 lines makes a medicine very important. Even think about it. If you don't get a result, or if you wanted to try out something, if you wanted to give, these are the indications you get it, give. Don't hesitate. Very dry cough, barking cough. You can think about Drosera, Kali cough, all that is. But formalin is another one of the best medicine. You can even give this with beautiful result. Dry cough, driest to the core, and it comes from the down. That is, you can even think about the pneumonia also. Okay, bronchopneumonia also you can think about the formalin. Formalin is a warmth of it, and it is like a vapor. You feel hot, you feel fumigated. Okay, trifolium pretense. Trifolium pretense is blind. Dry cough. If you are not able to get any medicines or anything, trifolium pretense is one of the best medicines. Okay. Cough in old people. I told you yesterday also, last class also. Okay. Cough in old people. Hypoxianium, creosote, Senega, Hyoscyamus. Hyoscyamus, everyone knows the elongated uvula, all that is there. But cough, dry cough in old people, even if it is in a case of COPD, don't think that all the specific medicines or you are just giving the medicine as blind without even single indication. But the old age cough with the diagnosis of COPD or CCF, anything of that sort, think about all this medicine because it's a life. You can even save the life with this medicine. So creosote is one of the best medicine. I explained it on the last time. Again, I'm repeating it today because it's all very important. And intercostal pain with the cough. Okay. Ranunculus bulbosus. This is with herpes. Ranunculus bulbosus. If the case intercostal pain, even with the asthma, you cannot even only give it with the herpes pain. No, ranunculus bulbosus. If you get the intercostal pain along with the asthma or cough or anything on that sort, think about ranunculus bulbosus. Asclepiasis, again one of the beautiful medicine. Asclepiasis. Homeopathy has lot of wonder medicines. You will say magical result. Even the bigger hospitals have started telling it's a magical result. We are telling it's not a magical result. 1 + 1 is 2, not 3. Asclepiasis, you read, it has got a difficulty rattling. You can even think about the dry cough with rattling. Not a kind of a wet stuff. It is dry cough. It is going into the wet and with crips and this. So think about in that stage, Asclepiasis is one of the best. Cough, evening aggravation, night. I told you, Prunus virginianus, especially in elderly people. Reading, laughing, talk, Ambragracia. I have explained it to you last time clearly. Drosera and Ambragracia. Salty expectoration. This is something you don't think that you will not get it. Salty expectoration. Kali, iodide, and Lyco. I have a patient called Jomon. 99% he comes with salty expectoration. So that is my experience with that. Kali iodide and Lyco. Plus, think there is it's a condition called starts with C. I really forgot it. I'll next time I'll tell you that. So for that specific condition, I will just give it to you by tomorrow. Okay, I forgot the name. That is a specific to salty expectoration. So diagnosis also counts in. If anyone can knows the specific diagnosis for the salty expectoration, please put it in the message. Voice, again, laryngitis. Voice, deep brass, verbascum. Verbascum. Verbascum is a hoarseness medicine. Even with aphonia is not aphonia, it's a hoarse talk. The voice is so husky, you cannot, it's not easy to talk. Verbascum. Hoarseness with aphonia. Selenium. Again, you can think about verbascum also. Menganum aceticum. Menganum aceticum is one of the best medicines. You have argentonatricum, phosphorus, all that medicines are there, commonly used. You get a common symptoms, you get a this one. But my experience, once I started giving it, phosphorus definitely my favorite medicine. But along with that, I have tried other medicines also, and in that Menganum aceticum has given me a beautiful this one. Plus, if you can make a mentha, last time I told you mentha, it can give you a soothing effect. Eucalyptus, again. So why not? If it's an acute cases, we can even make a mouth freshener or a gargle. Okay, instead of we taking that people asking the people to gargle with just plain water or anything, you can even think about our medicines. Belladonna, Euphorbia, Euphrasia, this one, eucalyptus, mentha. Okay, this one. All these medicines can be used as a, even as a gargle also, so that we get a better result, because we are competing with huge hospitals in and around my place. So I have to be getting results in a 1 or 2 days, otherwise I'm losing the patient. So first things I have, all these medicines can be thought about it. Overuse of voice, again, teachers or a public speaker, overuse use of medicines and hoarseness after that. Coca, Argentum metallicum, selenium, again weakness and paralysis, not paralysis, paralysis. Selenium, last time also given you a hint of that. Hemoptysis, hemoptysis with cough. You cough and cough with the blood. Okay. Hydrastis, hydramuriaticum, Ledampal. Ledampal and these two medicines are almost specific. You have Merxol, you have Droser, a lot of medicines are there, but these medicines can bring you immediate results. Hydramure and Ledampal. Fibrosis of lung, COVID, Senega and Bryonia. COVID again, Senega and Bryonia. 99% cases of a specific medicine. Sleep apnea. In that case of again one more beautiful medicine. Sleep apnea is more common nowadays. Obesity, all those issues brings upon sleep apnea and snoring. Sleep apnea, latrodectus mectens. Latrodectus mectens. Okay. Sleep apnea. Give it 3 times a day for another 3-4 weeks or maximum month. You will see the result. And this is the best. Instead of using the CPOP machines, try along with that. If you wanted to get rid of the CPOP machines, give this. Try with this. Okay, dyspnea ascending stairs, not chairs. It is dyspnea ascending stairs. If you climb the stairs, you get almost specific symptoms. Lobelia. Lobelia is one of the best medicine when you get, once you get dyspnea climbing the stairs. That is, you can even think about this one. CCF, COPD, all these cases, lobelia is one of the best medicine with all the crips, and it is like bronchioles get what are called damage. In those conditions also almost a specific stuff called lobelia. Dyspnea, something comes near the mouth or nose. Laskasis, once you lie down, once you in a COVID, you cannot eat. So we just bring the food or plate or anything next to the patient. You cannot get up. Lacasis, that all experienced after research in the COVID cases. Lacasis, dyspnea, something comes near the mouth or nose. It is common. Patient will come and tell you, doctor, he cannot drink or anything. If he just start giving medicines or food or anything with the hand or anything or that, we try to feed him, he get panic. He gets dyspnea. He refuses to eat because he gets dyspnea. So these are the simple cases you get it in the clinic. Only thing is that we have to be careful when listening to the symptoms. You don't have to go to the lot of symptoms, 10, 15, 20 cases. No, COVID cases, you don't get it. One or two symptoms, you get it for the patient or patient bystander. When you go to the IP or near the patient will tell you only one or two symptoms. Bystander cannot explain too much of symptoms. These are the cases where you can think about this lachesis. Dyspnea from stretching the arms upward. This is like this. Stretch your arms. Patient will tell you, when I stretch, I get dyspnea. These are all complaints of COPD grade 4 or higher the grade. COPD, dyspnea with walking, exertion, slightest exertion brings on the dyspnea. Patient will not come and tell you about this. Slight you can convert this routine into a slightest exertion also. Soralia, that is a medicine. Soralia is one of the best medicine. Dyspnea, amelioration, open air. We know pulsatilla. Pulsatilla is not the only medicine. Sulfur is also rack vicar. All that is there. We want oxygen. Dyspnea, amelioration by open air. Give it. Okay, respiratory pharyngitis, sinusitis. Sinusitis something which sinusitis is something which I wanted to explain also. If I just keep checking it where exactly it is, then it will be a problem. So sinusitis, these are the simple medicines which comes into throat, mouth, face. I'll go for the headache. Okay. We'll go for the headaches. Okay. That are the different explanations. Okay, we'll go for the I have to, it takes a lot of time to explain it, but I'll just go for the sinusitis only, specific to that, what I do. Okay, I have 6
Doctor, only 5 minutes remaining.
We can have it next time also. I can think I can
Yes,
do it with
yes,
all the experiences. I can again go for it.
We can have a discussion, question answer session.
And I'm really sorry. I became late. My brother-in-law is in a hospital.
No, for 5 minutes only. 5 minutes only.
Okay. No, it's not. I'm not leaving. I became late because of all this. I was running around.
No problem. This can happen
Oh.
to anyone. But still, that's what Dr. Sadhu said is all about. You just joined from hospital. That itself shows your immense desire to propagate and educate homeopathy. Those who want to participate in discussion may please raise your hand. I am inviting Dr. Beatrice for the same first.
Yes, thank you. Thank you very much for the interesting information. And I have a practical question. As you said, talking about Drosera, I also use this remedy here often, especially if in children, also in adults, if they have a dry cough, which is getting worse, sleeping at night. And as you mentioned, Doctor, it is said you should not use Drosera so often. But in my experience, I agree with you. I give it every night. It's like for a few days, and it's helping a lot. It seems to be a tubercular remedy. So what is your experience? You also give it more often, daily, for a certain period?
Ma'am, I give it every half an hour.
Half an hour.
Every half an hour, only 15 minutes. Because depending on the severity and the symptoms are of Drosera, I repeat the medicine in acute cases.
Okay.
Half an hourly, 1 hourly, 2 hourly, 4 hourly.
We talk about C30, huh?
Yeah, severe. The cough
Yes,
is very
C30.
severe.
Okay.
Yeah.
Okay. good to hear. For me, it's sufficient before sleeping, and they sleep well and don't cough so much, and it's a great remedy.
My usual prescriptions are phosphorus, drosera is repeated frequently. Nowadays, I give pertussin. If it is a rattles or anything is there, if there's a just dry cough, pertussin 1 one dose, then go for the indicated medicines. So it cuts short the duration of the cough. If it is a dry cough, if it is a we suspect bronchopneumonia or anything, I give a pneumococcin 1 dose to start with the medicines, then give the indicated medicine. I have found that people are responding faster and the duration of the complaints are getting shorter. Even if it's
That's
a viral,
interesting. Mhm.
even if it's a viral fever, give a dose of influenza, because nowadays influenza was not influenced with the patient. Nowadays, all the pediatrics, anyone tells that it is an influenza, they give it for influenza virus test. So, and they make them panic. It's influenza. It's a new diagnostic tool for them to make the people confused. People come and tell you, I have influenza. It's a new term here. Nowadays, all the pediatricians and people come and tell that, okay, I have got influenza. So I give, I went to the hospital for cough, fever. I took the medicine for that. Then cough is not going. So I have come to you. So in those cases also, if there's a viral pneumonia, viral cough, or anything viral respiratory complaints, give 1 dose of influenza, then all your indicated medicines. If you are a single medicine, okay, yes. If you are a mixing or whatever kind of the thing, give influenza. Same way, streptococcus. We are just keeping on experimenting at what is happening. So with experience, it says that in acute cases, most of the acute cases, it is giving a good results, better, faster recovery. Chronic cases, we are the leaders, but acute cases, managing acute cases, really tough with OP. If there is an IP facility, we can put them into the IP and with relaxed mood, we can see. The patient goes home. If the patient is not better, next day morning, they take it to the hospital. So we have to be very
Yes.
careful on that.
Yes, Dr.
Oh.
Beatrice can say water thanks to the session also.
Yes, thank you. So it was a very nice session. And before you came, we had a nice discussion about respiratory diseases among the group. That was also, we had a bit time to talk, was also nice. So very interesting. I admire your work. You're doing so great work with your patients in acute and chronic respiratory diseases. So thank you for teaching and being with IFPH, and thank you IFPH for your care and your enthusiasm to have these sessions every day. Thank you, Dr. Danish, Dr. Manoj, Dr. Jose. Always a pleasure.
Thank you. Yes, once again, we are inviting all of you to join the celebration of 5th anniversary of IFBH on 28th September here in Cochin, Taj Vivanda. Please join. You can register now with the rupees 3,000 per person, and there will be a rise of 500 rupees after that. So kindly register and join us. Come here and let us celebrate together. Let us meet one another. Let us discuss about many things. There will be short presentation. There will be a cultural program at the end, and some of the ministers as well as some of the VIPs and High Court Judge and all are attending the session. Hope all of you will join us for the same for the function. And tomorrow we will have a session from Dr. Najib, and Dr. Najib will be talking about sleep 101, and that is what going to be presented tomorrow at 8:30. Thank you, Dr. Beatrice, for joining the session, Dr. Isaac sir, and Dr. SADAT said at this beautiful session. And definitely we can have the other part of the respiratory disorders in the coming edition as per your convenience. Thank you all. Good night. Over to Dr. Manoj.